Well, someone could be saying now, how would someone go about erectile dysfunction? Erectile dysfunction, we have said, someone is not able to erect, or they are able to erect but they can't maintain the erection. They have performed the sex or they have not performed but they have not ejaculated. The erection is the problem. Here we say that mostly the most causes are physical factors. Someone has diabetes, someone has hypertension, someone has prostate cancer and other prostate issues, or even some other systemic diseases. So when someone has those diseases, they are likely to experience this. And usually we say that treatment indulges, or it needs you to include medical health professionals so that they can give you some drugs, or they can manage the causing the causing factor. When they get to know the reason why that thing has been developed, that's why they can treat you better. That's one. Two, it can be caused by psychological. It can be caused by psychological issues. Just like we said for premature ejaculation, this one can also be caused by stress, anxiety, and others. Like someone, you have gotten the erection, but meanwhile you have a lot that's going on in your mind. You need to know that the brain is the biggest sexual organ, and that's why most of you are going to have the loss of the erection, or you have lost the erection because you have activated the defense system of the body, and the body has cut off the pleasure hormones, and that's why you're losing the erection. So I would say, try to work on your brain, or try to work on the way you think during the sexual activity, or the performance anxiety. You need to work on it. However, we have some medication we can give you on these issues in order to make sure that those hormones are reduced and you are stabilized up as stairs. However, we have other medication which can help on saturation. Two, it can be caused by poor saturation. Poor saturation, we're talking about poor blood flow, and that's why we talked about systemic things, and we have been educating you about the better foods someone can take. So the foods we are always teaching you about, things like watermelon, things like ginger, things like greens, those things, and taking enough water, they can help good saturation, which will eventually make you maintain the erection. So sometimes poor saturation can also cause erectile dysfunction. The hormonal issue, the hormonal part of it is that most of the men, or some of the men, do not know that they have low testosterone. Testosterone is one of the major sexual hormones that we do have, and then when it is reduced, we do not have the erection maintained, because that's the reason it's not present. That's the reason you are losing the erection. So sometimes it's hormonal, so you need to get your hormones checked, and then you can get the treatment, or what we call hormonal therapy or hormonal replacement therapy, which can help you regain your strength and stability. Another thing could be lifestyle factors. Someone is taking alcohol, someone taking a lot of drugs. Include Viagra in those drugs. Some of you take are thinking that you are helping yourselves. You are actually killing your man deep down there. So we are saying that things like your lifestyle, alcohol, drugs, the way you sleep, you don't sleep actually. So those things that you do can actually affect the way you perform. I want to see you in our next video as we are educating you about how best you can perform to be a better person, and how you can improve your sperm quality. See you in our next video. Subscribe, like, and share so that we can continue providing this good information. See you.